Hello to my peeps. Thank you. This is another edition of 2 Cents, my podcast. I'm your host and your journalist, Nino. First of all, thank the man upstairs for blessing me to wake up for another day, opening my eyes. To all the people out there that are so gracious, that are subscribing on my channel, thank you. Please continue with them subscriptions because they are very gracious. You're very generous, and I appreciate you guys to the fullest. To the fans, the followers, and my listeners, I love y'all all. I love y'all very much. Shout out. What up to my man David? What's up, Big Marlon? What up, Donnie? What up, B.A.? What up, Dre? Big Blue? Marco? What's up to all my ladies that work with me, that always give me that good content or topics to talk about? Miss Lucille, Valerie, the other Miss Valerie, Miss Cheryl, Miss Mary Bell, the great Miss Ivy. Thank you, Miss Ivy. You know what I'm saying? Miss Erica. What up, Miss Shelley? Miss Naomi? Miss Amber? What it do? What it do? What's going on with all you people? What up to Mr. Miguel, Mr. Tony? What up to my boy Marlon, Norris? What's up to my nephews, Jew and Keith? To my son that I love very much, King. What up, MJ? What's up, Zion? Paw in the house. What it do? What it do? What up to all my other people out there? Raw Stricknine, what it up, little bro? What's going on with you? Hope everybody having a great day. And you know, day weekend is going accordingly. And if anybody else I forgot, what up, Luther? You know, what up, Big Bruce? I be forgetting my boy, Big Bruce. Michigan Flint Bruce. What up, Bruce? But anybody else I forget, I will get back to y'all. Y'all know who I am. I'm not doing it on purpose. You know, it's just that I got a lot going on and I try to get to this content. All right, this one here really hits home because I had, unfortunately, 2 of my family members that came to their demise and end up going and transitioning to the next life in this facility. Today's topic is, that was sent to me, why when senior citizens get older, they have regrets being placed into nursing homes. Why when senior citizens get older, they awfully regret being put into nursing homes. Many senior citizens regret being placed in nursing homes due to the loss of independence, privacy, and familiar surroundings. The transition can be emotionally challenging, leading to feelings of isolation, loneliness, and a sense of losing control over their lives. There are many layers to this, so I'm going to give you my opinion about it. And again, to my fans who follow Nino's 2 Cents, please comment negatively or positively because I really browse over you comments. A lot of my listeners and my fans be teaching me new things because y'all are very astute and smart and wise with y'all comments. So please, I'm just going to say my part about what I got to say, and then please comment. And I really be checking out y'all comments, you know, and I be taking it to the brain with what y'all be saying because y'all be saying some incredibly smart and, you know, very wise and very knowledgeable things. Appreciate it. Taking away independence and autonomy. We're going to get to one category. Restricted choices. Nursing homes often have set schedules for meals, activities, and bedtime, limiting residents' ability to make their own decisions. Well, that's what I think a lot of the people, especially the senior citizens, have to adapt to, and they have to change because even though they're getting old and they're coming from a home, everything is kind of set when you get into a nursing home. You know, you might be used to eating your meals a certain time when you stayed in a home or a resident. Say, if you're staying via by yourself and somebody was coming watch over you, or you were staying with family members in difference where when you get into a nursing home, then everything is a set schedule, and so now you got to adjust. You know, you might eat breakfast when you stayed, you know, by yourself or with your family. Before you came to the nursing home, you might eat breakfast, you know, maybe 8 o'clock in the morning. You know, at the nursing home, they might get up and give you breakfast a little bit early, maybe starting by 6. You know, also it's differential into lunches. Sometimes when senior citizens stayed home with their families, they didn't eat 3 square meals a day. And from my information or from knowing about nursing homes, because as I said in the introduction, I had, unfortunately, 2 of my closest family members. I'm going to let you know about it. My brother, who I miss, and of course my beautiful mother, they both ended, their lives ended, and they transitioned into the next life. Their last day was in a nursing home. But back to what I'm saying, nursing homes usually give you lunch. They usually give you breakfast, lunch, and dinner. And it's always on a scheduled, synchronized time. You know, not a minute late. And to a lot of senior citizens, that's taking adjustment right there. A lot of senior citizens, that I was going to say, don't even eat 3 times a day. So that takes adjusting too. Everything is kind of more routinely, as I see, when you're dealing with a nursing home. Loss of control. Seniors may feel that they have lost control of their lives over their daily routines and how they spend their time, such as when to eat, what to wear, and when to sleep. Yeah, because again, when you're in a nursing home, most of the time, the nursing home nurses or the nursing home faculty who works there, you know, the people that work there that tend to the senior citizens, they give them a bath or a shower a certain time every day. You know, a change of clothes. They sleeping patterns are different. A lot of senior citizens, when they stay at home or when they stand with their family, you know, they might not get up all day. You know, but in a nursing home, everything is on schedule. They have to take a shower a certain time of day. Basically every day. Sometimes it might be a little different because you got to look at it too. A lot of people, especially a lot of the residents that stay in nursing homes, they have to take medicine, so they have meds to take. Some of them be going through rehabilitation where we're not just taking meds, but they also be going through rehabilitation. We're working, you know, things towards their body. You know, they might have a bad knee or a bad shoulder. So a lot of nursing homes are equipped with a lot of equipment to physically give you rehabilitation as well as mentally give you rehabilitation, but with meds and everything that goes along with that. But what I'm trying to say back to this, they are awfully told what to wear. They are awfully told when it's time to go take a shower. Of course, assistance from the people that work in the nursing home, you know, the higher end, the people that work with the senior citizen. And they also are basically told when to go to sleep or when it's time to cut off the TV and go to sleep. And as I had seen too, a lot of senior citizens like to go to sleep sometime early. They rise early and they like to go to sleep a little early. You know, they like to rise maybe 5 o'clock in the morning, and then they like to, you know, shut down and go to bed by 8 o'clock in the evening time. And then again, I have seen a lot of senior citizens also love in their room, they like their TV or something to be left on. See, all them rules, they don't apply when you're in a nursing home because everything is, you know, once it's time to go to sleep, the workers or the faculty that work at the nursing home, they will cut off everything in the patient's room and cut off all the lights. A lot of senior citizens don't like their lights cut off. So see, it's totally adjusting that not only the faculty has to get used to when new senior citizens are automatically, you know, become new residents of the nursing home, but of course the senior citizens have to get used to the faculty and the routine and how they handle how they are handling the residents that are in the nursing home. A feeling like it's a burden. Some seniors may feel that they are a burden on their families and the nursing home staff, leading to feelings of guilt and sadness. Well, yeah, because they feel like that their life has slowed up so much. A lot of them have big ailments, and they feel like that they're in the way because some of them do need attention, but they need special attention. A lot of senior citizens in the nursing home need sometimes 24-hour watch because, a lot of them in there are dealing with mental depression. Some of them have underlying health conditions. Some of them take so many meds. A lot of them senior citizens in them nursing homes may take meds every other hour. And I'm talking about, I have seen it, maybe, up to 6, 7, 8 medications a day, different medications. And that's a lot. A lot of them are dealing with a lot of pain. They're lonely. So they're kind of afraid and scared. So around every shift or hour that people that work in the nursing homes, the faculty that's working in the nursing homes, or the people that attend to the senior citizens are always have to be on their P's and Q's. It's never a drop off because, again, they have not only one or two, but they have a lot of people that they have to watch over. And a lot of time, a lot of senior citizens have different problems that they're dealing with. And you also have, in a typical nursing home, different wings, of the facility. You might have the north wing, you might have the south wing, you might have the east, and you might have the west. And that's a lot of ground to cover. So, a lot of times that's why they feeling a burden. And also, senior citizens feel like it's a burden because now they've been taken out their home or staying with their loved ones because, unfortunately, a lot of times the loved ones still have to work. And as I was saying, a lot of senior citizens need 24-hour supervision, which means all the time. And it's not no knock on their loved ones because they still have to work and pay bills. But unfortunately, they can't stay home and watch over, their mom that has got old, or their dad that has got older, or even the kids can't watch over their grandmother or their grandfather. So now, when you take them to a burden home, when you take them into a nursing home, to senior citizens, they feel like that's the last line, before they eventually go and, transition on. So that's why they feel a burden. But, they shouldn't, because we all going to get old. We all going to need to be attended. We all going to need attention, and we all going to have to be looked after of. So that right there is a lot of time why senior citizens feel like it's a burden to not only their family, but they feel like the staff that's working at the nursing home. They feel like a big burden. A change in environment and social life. Separation from home. Leaving a familiar home neighborhood and belongings can become emotionally challenging. Well, yeah, because think about it. When that senior citizen left that home, they remember how things was in that house or their home they was living. They remember everything, what the bathroom was. They remember how things looked. They remember how things was placed certainly a certain way. Their belongings. Now, all of a sudden, they had their clothes maybe one way. Maybe that senior citizen, again, if they were staying by themselves and somebody was coming to watch over them, or even if they were staying with a family member, they had their own little room. They had their little TV. They had their clothes put in a certain little order where they put it in their little dresser drawer or nightstand or things in place like that. And see, now it's a difference. They were used to the neighborhood they was in. See, and then again, a lot of senior citizens, when they move from one neighborhood to another, now they're kind of lost because they may be used to kind of things that kids coming to see them in a certain neighborhood. You know, a lot of times, a lot of senior citizens that stayed with maybe their kids or whatever like to go out and sit on the front porch or sit out front and just watch everything, watch the kids play. Kids come by or people come by and talk to them, things like that. Now, that's a lot different when they go to a nursing home, because a lot of time, the only time they get to go out is maybe in between breaks, or if they smoke a cigarette, you know, and that's around in the middle part of the nursing home. They don't get to sit out front, and then again, it's not the same friendly faces. Not saying they bad faces, but it's different faces them senior citizens are seeing, contrast to when they were staying with their loved ones in the neighborhood to now they done moved to the nursing home. So see, that takes adjusting. That takes them getting used to it. So, you know, that can be emotional too, because everything is different now. So now they have to learn how to adapt again and get used to it and become familiar, and, you know, just let it all soak in while going through the process. Loneliness and isolation. Being surrounded by strangers and limited social interaction can lead to feelings of isolation and depression. Well, there you go right there again, because a lot of times when these senior citizens are sent to these nursing homes, they are left a lot of times in their rooms by themselves, you know, even though usually they would try to appoint when a new senior citizen comes and become a new resident of the nursing home, they try to have a room where it's two senior citizens in the same room together, but maybe one of them is a little bit more sickly or have more ailments than the other one, so maybe they don't interact together because one of them might be in a little bit better health, whereas the other is maybe a little bit sick and always sedated. So now that one senior citizen is in that room and is basically by themselves, because if the one is not sedated through medication because of the health problems they're going through, a lot of time they might have them passed away, you know, transition on, and so now that senior citizen is just in that room by themselves. A lot of isolation, you know, a lot of loneliness. And I can tell you one thing I know for sure: as you get older, loneliness doesn't bring but more and more depression. That's what a lot of older people regret about getting old, you know, is becoming lonely, because they want to keep something, they want to continue doing something, even if it's not physically. Even just talking to somebody all the time keeps their mind and keeps their mental activity going. So that helps them a lot, because if you just isolated and sitting in a room by yourself, and it's not no knock on the staff or nothing like that, because they're attending to more other senior citizens, and you know, giving them medication, making their rounds. But it's just a lot of time senior citizens are left isolated in their room by themselves, and it takes a toll on them. Loss of privacy. Constant monitoring and community living environment can make it difficult to maintain privacy. Well, because the nursing homes have the masses, have an abundance, have a lot. It's a lot of senior citizens in there. Some of them, you know, are sent to nursing home because they stay by themselves and they're so sickly they'll need supervision constantly all the time. Some of them are not as sickly, but you know, they need some supervision now and then, and unfortunately that, as I was saying earlier, their loved ones have to work. Now they do their best to come home and tend to them, but you know, with these senior citizens, it's a full-time job. They have meds they have to take. You know, a lot of times you have to take them senior citizens to doctor's appointments. They have things they have to go to. You know, they have to go to the chiropractors and things like that because they have bad back, bad hips. You know, they have to rehabilitate that. A lot of it's mental depression. They have to go through that. A lot of them have to go take CAT scans. So a lot of it is you have to put them in the nursing home because, again, their loved ones want to take care of them, but they have to work. Now, they take care of them where they can put a roof over their head and things like that, but it's the constant little small things and details that you have to do with taking care of senior citizens, especially when they get old, especially if they begin having a lot of problems mentally and physically. The fear of unknown, unfamiliar setting. Entering a nursing home can be frightening, especially if the senior has never experienced this type of environment before. If a senior citizen is just surrounded by love and joy through a family, you know, always happy, always had a lot of people, you know, had a lot of attention. Everything is always upbeat. That's the environment that they used to, you know, used to going out with their family, even though they might be even in a wheelchair or whatever, but they're doing a lot of things that their family takes them to, you know, takes them out to functions and things like that. Now, all of a sudden now, when all that's to stop and now they are restricted to a nursing home, that is a big jolt. That is a big change of direction in their life. They're going from always upbeat, always in something festive and happy, going out with their family, to now they come into an environment or they come into a facility where, you know, they kind of sheltered off. Everything is on the schedule routinely, and that's a difference. You know, you have the chance of, again, being lonely times. Maybe not all the time, but it's going to be occasions where you're going to be lonely and things like that. So that takes a real hard hit to them because they're going from happy-go-lucky to, you know, I'm having so much fun, to now, you know, every day is a new journey. You know, they're used to having good days to now when they was with their family or before they was admitted to a nursing home, to a lot of times when they're admitted into a nursing home, they have good and bad days. Uncertainty about their future. To move to a nursing home often represents a significant life change. Yes, it does. And seniors may worry about what the future holds. I remember before my mom came and they got her, I'm talking about vehemently, I'm talking about very, very much begged me, please don't let me be taken to a nursing home. A lot of times when a lot of senior citizens are admitted to a nursing home, that's just like them getting their death certificate. They're just like they're getting their toe tag. I mean, the end is just right around the corner because now they'll give up. See, the atmosphere, and it's not a knock on the workers, the staff at the nursing home, but just to a lot of senior citizens and older people, that whole energy, it just drains them. It just takes it out of them. They don't want that. And again, a lot of times, there's a lot of so-called things that be going on in the nursing homes that I will mention a little bit in a little bit, that I believe why senior citizens are so against going to a nursing home. Because though a lot of nursing homes are pretty good and, you know, they'll do a decent job, it have been a lot of faults and it has been some questions about nursing homes. And this is what I'm finna get to. Poor staff to resident ratios. Poor staff to residence ratios. Concern about the staff and care. Inadequate staffing can lead to delays in care and feeling that residents are not being adequately looked after. Well, yeah, because a lot of times, and I'm about to say this, a lot of their staff, a lot of them young ladies or them young men, they do them senior citizens bad. I'm just going to keep it a buck with it. No more, because they do them senior citizens bad. They'll never think that one day that could be them. Them senior citizens, they need care, they in pain. See, it takes a special breed to be able to take care of a senior citizen. And not only take care of them, but do it with a calmly and professional way. A lot of time, them staff bring what they got going home to work with them, and I believe they take it out on them senior citizens. Now, again, I know them senior citizens can be a handful, but they are old. A lot of them are in pain. They have underlying conditions, They have anxieties. They're on so many medications. Just imagine if you was taking 5 or 6 different medications a day. The combinations of a lot of chemicals clashing and messing with your brain and mental. That's going to make you kind of feel a certain kind of way. That's going to take somebody that has a solid disposition on themselves to be able to handle these senior citizens. And unfortunately, again, a lot of them staff members that be young, they so wrapped up on what's going on at their house and on their phone. A lot of the women are going through things with their boyfriend. So when a senior citizen is maybe hollering out she need help or something like that, or they need help, whereas a man or a woman, they're ignoring them because they're worrying about what's going on with the woman or what's going on with their boyfriend. So if you turn it with the man, the men that works there, they worrying about what's going on with their girlfriend, and they treat a lot of them senior citizens very rudely. They talk bad to them. But see, this is what kills me about it. But now, if you're the family members and you come up there, and now them same staff members that have been treated, your relative or your family member wrong, they swear to God that they love them. They are just so devoted and taking care of them. They love their presence, and that's just the furthest thing from the truth. I can recall this, and this is for facts. My mom, from when she went in there until her time when she left and the good Lord came and got her, her teeth was knocked out, things like that. And that's not nothing but reckless attention being by staff members, because what it was, she trying to stand up and fell and knocked her tooth out. Well, right then and there, you supposed to have staff members helping her trying to stand up, because she might was trying to go to the bathroom. They'll hear, them staff members will hear them patients calling out and crying that they need help, but they will ignore them. And I know a lot of times the staff members are overwhelmed too, because they are dealing with a big full plate, which means they're dealing with a lot of patients. But a lot of times, if you can't handle what you signed up for, you don't need to even attempt to try to do it. Inadequate care. Some seniors may experience neglect or inadequate care, leading to feelings of frustration and anger. They neglect them greatly. And so now, the senior citizens are frustrated and angry, and they feeling bad toward themselves, because this thing, if you're laying in the bed and you can't move good and you crying out that you need to go to the bathroom before you may urinate yourself, but you can't get up to help yourself or walk to the bathroom yourself, and you steady ringing out and hollering, and nobody don't want to come get you, and unfortunately, you urinate in yourself, and you have to lay into that. That is so cruel and just not cool. But senior citizens face that. They face that. And a lot of time, you know, the head that's running the senior citizen nursing home, they know that. But what I learned about them nursing homes too, they are kind of like the police. And I'm going to keep it a buck with you. They're kind of like the police. They keep everything in-house, and from the top to all the way down the pecking order, they're going to look out for each other, and they're going to have each other back, where it's neglect or whatever going on. It's not too many of them that's just going to keep it 100 and going to come out truthful, especially when it's negligent, because they know they are all liable for a lawsuit. Lack of personalized care. The focus on efficiency in nursing homes can sometimes overshadow the need for individualized attention and care. Well, yeah, because they're worried about keeping the nursing home up and going, but then you're not doing what the nursing home is there for. That's to take care of them patients, no matter what condition they in, no matter how sickly they are, no matter, you know, what's the purpose that they was brought into that nursing home for. You supposed to be there to take care of them. Why do you think I believe a lot of times, a lot of senior citizens, expect lifetime of living quickens when they go to a nursing home? You know, you'll see a lot of them, they don't even make a year. They don't even make a year. They make it 6 months. My mom didn't make it a good year and a half. I mean, she went down the drain quick. Now, my brother, he also transitioned and went on to the next life from a nursing home. Now, he lived in a nursing home for a while because, you know, he had a mental problem. I had mentioned this about my brother. I had did a podcast on him. It was back, my brother was admitted to the nursing home because, unfortunately, back when he was younger, he went down to this college called North Texas, and he had what you call a Mickey Finn dropped in his drink, and he never was the same mentally. So he had to have supervision. He was on all kind of medications, you know. He tried to take his life before he ended up jumped off a bridge and everything. I'm just going to keep it a bug with you. But he lived a long time in a nursing home because he went when he was young. But down the stretch of his demise, and he passed away 2021, where my mom passed away in 2017, the last stages before he went, he was getting neglected real bad too. See, I think the nursing home is like this too. It's a numbers thing. It's you know, we got new coming in, so we're gonna move the old out so we can bring the new in. Because it's all about money too. Because think about it, most of the people that are in nursing homes, they get supplementary income. You know, they get a check monthly. Some of them unfortunately have rich kids or family members that pay that high bill too. So it's all about money too. And just like anything with money, when you know, when your income that you paying to stay in the nursing home gets low, or somebody that want to be admitted to a nursing home, a new patient, financially, their income can be more than yours, they gonna move that lower one out, which means, okay, now they done went from they can do everything for him or her to now they can't do nothing for them. So now their time is up and their demise is straight up the imminent. So, you know, and then they end up just passing along. But I just want to mention that too. Coping strategies. Maintain connections. Encouraging visit from family members and friends, and facilitating participation in social activities can help alleviate feelings of isolation. Well, some nursing homes do, you know, get all the patients together and play games with them and do things like that for just a certain time of day. And, you know, I would encourage to go and visit your family member in there, because we used to do that. But see, now, I'm going to go back to what I was saying earlier. That's when you go and visit your family member or family members, because unfortunately I had two of them in there, and I had two of them in there at one time. Now that's when they made like that, the staff members that they love your family members in there. They just love them to death. They make their day. They are their favorite senior citizen, or the staff will make like your family members are their favorite patient in the whole nursing home facility. Not doing nothing but really putting on the front, because I know for a fact, soon as if you as the family member leave and go out the door, man, they treating them patients, them senior citizens bad, talking bad to them, cussing them out rudely. I mean, some of these staff members should be put in jail how they treat these senior citizens. Because again, if you not equipped for the task, then why you signed up for them, if you know what I mean. Bringing familiar belongings and pictures and decorations can help create a more comfortable and familiar environment. It can, because what it does is it puts back into the mind of the senior citizen that homely environment. Because still, a lot of senior citizens, the nursing home is a new thing to them. It's a whole new approach. It's a whole new walk of life. So now, that's a new thing to them. You bring them decorations from the house. You bring them certain clothes, belongings. So now, the senior citizen is feeling like more home. And then when they feel like they're more home, then they'll feel more they'll feel like they can open up and more, more accustomed to being able to deal with being in a nursing home. Now, the thing about that is, when you bring belongings from the home and certain things like that, you better tag them and write them down, because, boy, they will be gone with the quickness. And the sad thing about it is, I'm going to keep it a buck with you on this. That's not them patients stealing a lot of them patients. That one patient is not stealing another patient's belongings and things that the family members bring from the home. That's them staff members that's stealing them belongings and things that the family members have brought from the home to their loved ones that's in a nursing home. And you can believe that. Advocate to residents' rights. Encouraging open conversation with staff and encouraging open conversation with staff and advocating for residents' needs can improve the quality of care. Well, you can talk to the staff and you can encourage to the staff. And a lot of times when you sit down and you talk to a lot of these staff, they really are solid. They really do, they really try their hardest to make it a pleasant, new road that your family members going through. Now they are new resident of the nursing home. But then again, I believe a lot of time when you talk to the staff, you as the family member is going in one ear and coming out the other. Because again, they gonna put on that smile and we gonna do whatever and any means necessary when you standing there in front of them. But the big thing you need to always check, and the big thing is when you gone, your time when you as a family member are not at the nursing home. So, all that you talked about as far as your family member and improving her or his stay there, she has that materialized or has that went down as you come back. Because, people going to say what they going to say, and they going to confirm there's going to be changes in front of your face. But if you're not there to see it on an everyday basis, then most of the time it's not going to go down. But you got a few that stick to their policy and will help, again, will help you to help your family member to make a nice certificate, a nice, stay their time at the nursing home. That they will do. But most of them, again, they are dealing with so much. And I'm not saying that staff member, them people don't have pressure. Because that is a pressurized cooker too, to be dealing and running a nursing home. But you got to realize you're dealing with old, sickly people. And I know one thing, you don't do senior citizens wrong, and I know they can be a handful, but you don't do them wrong. You know, you don't. You don't do them wrong because they didn't ask to be there. And then one day you got to realize how you doing them, that's going to be the same way you're going to be in their shoes one day of what you going through as a senior citizen. If you make it that far. Seek emotional support. Talking to a therapist or a counselor or joining support groups can help seniors process their emotions and adjust to their new living situations. Well, that's true, and I have seen it, but a lot of times that still don't, that doesn't stand strong either. But you will have a lot of times you go in there and they'll have a band of senior citizens and they'll have, counselors and therapists talking to them, trying to make it easy as possible. But I believe some of them come out of it, but behind the scenes when nobody is looking, well, nobody on the outside looking, we know how they were stick together on the inside. The damage has been done so much that sometimes it's too much to come back from, So, again, I can get it why senior citizens are very hesitant and very rebellious about going to nursing homes. I hope if I live the rest of my life, when the man upstairs, the good Lord, come get me, I hope that, unfortunately, I don't have to be in one, As I said, my mom was ended up in one. It was not by my call, but I don't want to go into that. My brother was in one because he, unfortunately, had something dropped in his drink, and his mind wasn't the same. So, he ended up having to have supervision all the time and to take so many meds that it was crazy, man. It was madness. Why, when senior citizens get older, they have regrets for being put into nursing homes? 2 cents. The